and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Short, physical therapist.
Brad Heineck, physical
Together we are
therapist.
the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Got a cool video for you folks today. True sciatica relief, at-home treatment, professionally proven success over many, many years, I would say.
Right.
Brad?
And we feel very adamant about this. This is, I'm excited to let people know about this.
Yeah, this is really good for people who are in pain. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free. We upload every day. Also, yes, you want to go to our website, bobandbrad.com, because we're always giving something away. Right now, we're giving away a bunch of these orthopedic donut pillows.
Yes.
These are great for if you have coccyx pain,
right,
tailbone pain, or if you have like ischial bursitis.
Right. As a matter of fact, we have one of our people in the office. She uses one, and I don't even know if she has that.
She doesn't have any of those.
She finds it comfortable.
She's got a bony butt, I think, so she just sits down on that. I mean, it's more comfortable.
Right.
All right. You can also find it on Facebook, and if you want a short version of us, go to Twitter or Instagram. 60 seconds of Bob and Brad a day.
Bob,
Brad, take it away.
That's right. So, you know, thinking about this, people on YouTube are coming to us to see if they can help solve the problems without seeing a doctor or the therapist, or else just get more knowledge
or
about
as
the problem.
adjunct.
Right. Yep.
Right.
That's a good
word.
term, adjunct. So this all falls into place because the person that we're talking about is renowned and worldwide known in the therapy world, in the medical field, for low back pain and sciatica. His name is Robin McKenzie, physical therapist out of New Zealand. He started back in the 60s. He actually started a system that's now worldwide.
Yeah, it's in at least 36 countries.
Right.
I mean,
and I think it's approaching 40.
Yeah,
I have
widely accepted.
Right. And even better yet, his whole approach to medicine is to educate the patient how to take care of themselves at home, which is exactly fits our whole genre here.
Yeah, that's what I liked about it right away, why I was attracted to it, because it doesn't make the patient dependent upon the therapist.
Right.
You are in charge.
Right, exactly. So how does this system work, and how can it work for you? We're going to show you the whole concept and some steps to it, and give you some guidance so you can get through this.
Where you can get more information.
Right,
through that,
exactly. So the first thing that is a very interesting story that Robin McKenzie tells, I'm not going to go through it exactly, but in the clinic he found out that when you have, what are you laughing at?
Well, it was a funny story.
You want to tell it?
Well, just very quickly. So back when he first started in the 60s,
right,
it was considered like anathema. Like
let me show.
It was like terrible for anybody to lay in this position.
Right. Back at that time, if you had sciatica, everyone was doing flexion exercises. Right. And he told someone to go lay down on his plinth.
Right.
And
it was set up like with an arch on it.
Right. So the guy laid down on it face first because he was going to lay on his stomach. And the plinth was up like this. So he laid down and his back ended up being positioned like this.
And Robin didn't know that. At that time, that was considered like the worst thing to do for your back.
Right.
So Robin told him to go in and lay down. He lays down. Robin comes in and he sees this, oh my God, what have I done?
This guy is not supposed to be laying like this. And the guy had terrible leg pain when he walked in. And the guy's laying there and he says, you know, Mr. McKenzie, my leg pain is gone. And
McKenzie says, of course it is.
So anyways, long story short, I don't know if it's short, but he realizes and develops a system of centralizing the pain. If you can get rid of the leg pain, everything in sciatica starts to dissipate and go away.
It starts to improve.
So then that's called centralization.
Yep.
So when I say centralize, we're trying to get rid of the numbness, tingling, pain from the leg and have it move up. Okay, why don't you turn around, Bob?
Go ahead and
show. Let's say Bob's a patient. He says, oh, and the red lines represent where his pain is.
Oh, and it's going down.
And it's going down the leg. This is a typical pattern all the way down to the ankle. It can go down to the foot. So I'm going to show Bob some specific exercises after the evaluation. And then I'm going to say, go home, do these exercises. I'm going to tell him how to change his posture to make things better. He comes back the next day and he says, oh, my back hurts a little bit, but the pain in my calf has gone away. So I'm thinking to myself, beautiful, because I
Yeah.
know the McKenzie system. The patient's still upset because his back hurts and it hurts down the leg. I explained to the person, it's getting better because it's pain down in the calf is gone.
It might not even just be the pain. It might be numbness that
Right.
was there, and that's
Perfect.
better. Or it might be weakness,
Right.
and that's better. Like sometimes the greater toe, the big toe,
Yep.
I push on it, just gives right away.
Yep.
We do a few of these, and I push on it, and it holds a little bit. I mean,
Yeah.
after they've done it for a week.
Right. Right.
And that means, again, all these signs, the burning pain is gone.
Yep.
You know, whatever.
Those are all symptoms of nerve pain from the nerve being pinched from that herniated disc. Okay, so this is good. And then I go through some more exercises, some specific exercises, change the posture, maybe use a lumbar support, comes back 3 days later, and the pain goes away from there. And now all we have is pain up in the low back. So now the pain has what we call centralized to the low back, and that's great. We're going to continue to work with it until this pain here goes away, and the person at that point is feeling much better.
Right.
And then we go into some core strengthening and some body mechanics so it doesn't happen again.
It doesn't come back again.
Right.
Right.
So now they're probably wondering, well, what exercise do we do to get things to centralize? We can't go through all of them in
It's
one
a
video,
lot, right.
but we can go through the most common one.
And plus, if you type in, you know, go into our little search, that little search thing, that
Yep.
circle, and type in Bob and Brad McKenzie.
Yep.
McKenzie.
Sure.
We'll take you right to a bunch of videos that we go into more detail.
Right.
on how
We
to
have
do
a
it.
playlist with probably
Right.
30 videos on this. Don't get overwhelmed with it because you'll
Yeah.
pick out specific ones. So first thing that a lot of people don't think about and we address right away is posture.
Right.
Seated posture. Now,
You
I-
got the.
oh, there they are. I said I pulled out my lumbar support somewhere. Oftentimes, a herniated disc can be simply created from poor posture over a period of years, or if you did it lifting or some other way, it will maintain or won't get better until you correct your seated posture. So we're looking at the arch in the lumbar area, and we want to keep that arch maintained while we sit. So if you sit like this, and that's going to do nothing but irritate your posture. As a matter of fact, McKenzie had a story he told where he came in, he talked to his patient about sitting properly, and the person came in the waiting room like this, and McKenzie came out and saw his patient sitting like this. And he was like in his 60s at the time, I guess. And he was very upset with the patient and let the patient know.
I haven't heard this story.
Oh, really?
No.
No, one of the instructors told us that. And he said, well, I would never do that with my patient, but maybe when you're as old as he was and been doing it as long, you got to let the
You're
patient
fed up
know.
with them.
Yep. And they'll remember it. Then it's like a parent scolding your child. So we use lumbar supports, and it depends on the size of the person, the chair you're putting it in, but that maintains that arch, and that's going to help hold the disc from bulging and actually help centralize it and get the pain centralized.
Yeah, now you can imagine, like if Brad was a larger person with maybe a little more padding on the butt,
Right.
you might need a bigger support then.
Right.
I mean,
right.
because it just wouldn't do the
Right.
job. And a smaller person needs a smaller
Right.
support.
And we have a video dedicated strictly on lumbar supports and
Sure.
how to make it fit you. And you don't have to buy one. You can actually make them out of towel rolls.
Yep, you can certainly start with that and then maybe eventually buy one too.
Right.
So.
Yep, exactly. Bob, do you want to
Yeah.
show them this is the exercise that is known through McKenzie, but there's a lot of times we modify this and
There's
change
huge
it.
amount of variations. Sometimes you can't even lie like this to start off with. You might have to start with a couple pillows underneath you.
Right.
But if you're able to, if you can get down in this position, you might lie this way for a few minutes, and then eventually maybe even just get up onto your elbows,
Right.
kind of a prone prop.
Yep. So we're starting to extend the low back,
Yep.
and that's going to help centralize that pain like we mentioned earlier.
And sometimes we have people even rock back and forth like this, Brad, a little bit. But
Yep.
eventually, what you're trying to hope to do is get your hands underneath your shoulders, and you're starting to press up like this without bringing my pelvis up.
Yes.
That's the key. If your
Yes.
back is so tight that you're just coming up like this, you got to work in this little range right here to start stretching the back out. But eventually, what you want to do is keep going further and further. And again, this should not be increased pain. This should be less pain, and we're hoping again to see that pain go out of the leg while
Right.
you're doing this.
Right.
But eventually, you want to get up all the way up to this point.
Right.
And again, there's a whole bunch of variations to this. We're not doing it justice today at all.
Right. But if you do have sciatica and you really want to self-treat, and you can look at our videos and our playlist. If you buy this book from Robin McKenzie, he wrote it. It's specifically written for patients. It's a patient guideline, and it's only $10. It's actually a bestseller on Amazon. It's a popular book because it's a good book.
Yeah, look at the ratings.
Right.
You'll see a lot. It helped a lot of people. It's funny. I had one of a patient with neck pain, and I went over stuff with her, but all I did is give her the book. She got better.
Yeah.
I mean,
Did she read it?
She thought it was a miracle. I mean,
Yeah.
she really did. She was
Yeah.
suffering from pain for so long.
Yeah.
I mean, she thought it was literally a miracle.
Sure. I know. Yes, below in our best, the books that we love.
We'll have it.
Yeah.
We'll have a link down below again in the description.
Sure.
Or if you're on Facebook, you'll see it in
Okay.
the description.
The other thing that we are going to do, this is probably going to be
All right.
in March of 2020, we're going to have a whole series of sciatica treatment with details on how to go through this.
Yeah, we're going to have a whole program
Right.
that's going to outline every step you should do when you have sciatica.
Right. We're going to have printouts available.
Yeah.
Yep.
This is all going to be on our website.
Yes.
So if it's March of 2020, you can go to our website, Bob and Brad, and look for the series of videos on sciatica.
Right. Yeah. So we're December of 2019.
Yeah.
So we're working on it.
We're going to be under pressure now. We got to get it
I
done.
know. Homework's got to get done.
All right. Thanks for watching.